Welcome to Help! I Have Kids. I'm your host, Pam Marshall, a mom of 5 and a pediatric occupational therapist with over 35 years experience. This podcast is designed to equip you with practical tools, insights from experts, and real life stories. Because at the end of the day, you are the head of your child's care team. Each week, you'll hear from pediatric experts and fellow moms like you that will help build your confidence. They'll offer clarity and empower you to make informed decisions that work for your whole family.
Hi, welcome to the Help I Have Kids podcast. I'm Meredith. This is Mary Jenner. She is a nurse, an innovator, an entrepreneur, and the founder of the Butterfly Pig, which is a company that's changing how children experience healthcare through play and emotional safety. She's made it her mission to ensure that healing never causes harm by equipping hospitals, providers, and families with the resources and frameworks to deliver emotionally safe, family-centered pediatric care. Mary's work has reached over 100 hospitals around the world, and she's helping parents, providers, and kids see medical care in a whole new light. So we have many moms who are listening to this that have children with medical needs or have had hospital experience, and so I'm really excited about this episode. Mary, how are you doing today?
Good. Thank you for having me on. I'm really excited to be here.
Awesome. So we always start our podcast with one of our favorite pieces of advice. What's your favorite piece of advice that you have received as a healthcare worker or as a mom?
Honestly, I would say it would be to take everyone else's advice with a grain of salt.
Mm,
Because I feel like there's a lot of, everyone loves sharing advice, but every kid is different. Every human is different. Personalities are different. So I have received a lot of bad advice, I would say. So I'd say taking others' advice with a grain of salt.
yes, I completely agree. I have a newborn, maybe not newborn, she's 5 months old, but in that stage, whenever it's your first kid, you get all the advice. And she's different than a lot of other kids, and I've just realized, taking it with a grain of salt, that's great advice. Needed to hear that
Yeah.
today.
I know I
um,
have 2 daughters and they're vastly different. So what worked for my first is like not at all what's working for the second. So
oh yeah. Oh yeah. Okay, let's get into it. And what is your background in? And what made you want to start the Butterfly Pig?
my background is in nursing. I started my nursing career in pediatric oncology, and that's where I recognized the gap and the need for these toys to
Hmm.
be able to provide like age appropriate patient education. But it really wasn't until several years later that I opened the Butterfly Pig. And I've always been a creative at heart. So when this all started to happen, like it was really just me pursuing what I thought was fun and what I thought needed to be out there in the world. So it was kind of just a whole mix of me and my entire life and all my experiences coming together into this one mission.
Wow. I'm sure you never thought you would be creating these toys and given your experience. So that's awesome how life has just taken you to where you're at now. That's
I
awesome.
know. And it's been like one step at a time. It's really kind of interesting because it started when I was on maternity leave mid-pandemic, and I really was trying to make toys that were more inclusive because I
Hmm.
wanted to figure out we weren't going out in public because it was a pandemic and it was California wildfires. We were stuck inside. So I was trying to figure out how to build like a foundation of inclusion in my daughter at the time. So I was looking up diverse dolls and inclusive toys, and that's what I started doing was just making these medical toys for inclusion And then it clicked as I started doing it that I could be the one to make those tools that I needed while I was in the hospital as a nurse. So it just was like one thing leading to another to get us to where we are now.
That is awesome. I love that you were trying to make toys for your daughter, and that's what led it into what was like the first toy that you made for your daughter.
It was a cochlear implant. So it was to go on a doll and a cochlear implant. And I was making them to match daughters, or sorry, I was making them to match another mother's daughter. And so I made her a set, and then I made an extra one for my daughter to start getting used to like just what different medical needs could look like.
That is awesome. I'm sure there's a lot of moms out there that maybe their kids don't have the medical necessity or medical needs, but they would love to just like teach them about, why is their friend using an AAC device, or why does their friend
Exactly.
have like a device connected to their stomach, or like just learning about those different things. My daughter had a NICU experience, so I'm kind of thinking about she's gonna look back at pictures and see her with a CPAP on, or yeah, like an
Yeah.
oxygen on, or she's gonna see like a pick line, or just all of these cords on her, and she's gonna be like, "What is that?" So I'm just really excited. I'm gonna buy some of these for her, and just
Yeah.
teach her about like what happened, and on down the road she's gonna have some surgeries, so I'm um, that they'll be super helpful for her. And I
Yeah.
was really excited whenever I reached out to you to do this podcast,
Yeah,
just
and
because of that.
there's a study showing that just 3 minutes of play with disabled represented toys made kids more likely to include disabled peers. So it's really just them seeing it represented in play normalizes it. I thought it was crazy. It's just 3 minutes, but I've seen it with my own daughter where she sees all of our medical devices and assistive devices in toy form. And then when we're in the real world, normally kids would stare and wonder, and she gets excited. She says, "Hey, I know what that is." So it really just changes the way they look at things. It's not something to be afraid of, it's not taboo.
Yeah, yeah, that's awesome. Um, the butterfly pig is such a fun name. What made you come up with that name?
It's actually named after a children's book I wrote. So, how that happened is I've just always loved the phrase when pigs fly, and not as for the notion of impossibility, but rather challenging it. And so I wanted to write a book about a flying pig, and I thought, why doesn't a pig with butterfly wings exist yet? So it's a story about inclusion and self-love and embracing differences because this pig's the only pig born with butterfly wings. And after I wrote the book, that was probably 4 years before I opened the business. So I had the book written, and then as I started exploring opening the business, I thought it was just like the perfect meld because I want kids with medical needs to have self-love and be included as well. So it really just kind of worked together.
I love that. That is awesome. Um, that's really cool how you can just like take an experience like writing a book and turn it into this like empire that you have, where you're like creating this these toys for over 100 hospitals. I read that's awesome. That is awesome. How are you
Yeah,
in hospitals? Like what are the, I mean, obviously it's probably, I'm sure Child Life uses them,
exactly.
but yeah, how are they in, and how did you get into hospitals, and um yeah, and how are they being used?
It really started with word of mouth. I believe it was a lot of the parents requesting these tools to be in hospitals and making child life aware they exist, and child life specialists like looking for resources because right now they have to make a lot of their teaching and play tools themselves from scratch. So it is I would say 90% of the hospitals we're in, it's through their child life departments, and they're
Mhm.
utilizing them to teach kids and, be able to process what they're going through play. But we do have some nurse managers that have reached out and wanted to equip their nurses with a way to provide patient education and build rapport with their patients too. So that's really how I utilized this type of thing as a nurse. We didn't have the toys yet, but I would use hospital supplies to, demonstrate a blood draw on my patient's stuffed animal first. And it's a way to lower defenses and build trust and educate what you're going to do. So it really it is so helpful for nurses as well.
Yeah, that's awesome. I was thinking about the MRI that you have. That is
Yeah.
so that's so cool. Tell me about what like led to that. I know I've never been in the medical field or really ever had any experience with being in a hospital or having special needs. But whenever my daughter was diagnosed in utero, I went through two MRIs, and I'd never been through an MRI. And I knew it wasn't scary, but even just like the thought of being in a tube and not being able to move for however long, I was just like, I'm gonna get claustrophobic. I don't know. And then all the crazy noises that I was not expecting. So yeah, just tell me
Yeah.
about. I can't imagine being a kid and yeah, just not
Yeah.
knowing what it was
I
gonna be
mean,
like.
imagine if you tell a kid, "Oh, we're going to put you through something that looks inside your body." It sounds like you think you're explaining it the right way, but they might be imagining look inside my body is like cut me open and look inside. Like they might not realize like what
Yeah.
actually is going to happen. And a lot of kids, I probably every kid has to be strapped down
Mm.
because you don't want them moving. So even if they're going to stay still, there's still like this like Velcro thing they put over them to make sure that they don't move during it because it's such a long exam. So Lego actually has a toy MRI that they just recently came out with a study showing that it reduced sedation needs and reduced anxiety. And I think that it just makes sense that if you can show a child exactly what to expect, like a little replica of it, then they will know. So it's a, we modeled ours after a CT scanner, but we made it so you can also use it for MRI plaques. There's a QR code you scan and it takes you to the actual MRI sounds you're going to hear. Because
That's
that's what's
awesome.
often scary for a lot of kids is those loud knocking noises.
Hmm.
So it has the sounds you can, and it has Velcro on it. So you can show them that they'll be exactly what to expect, that they're going to have to lay on a table, there's going to be Velcro around them, here's the sounds, and you'll be going through the tube. And it really just helps prepare them because the more realistic a tool is, the easier it is for them to map that onto their own experience. So that's why it helps to have realistic toys like this when you're explaining what's going to happen.
Yeah, that's awesome. And even just like playing with it, they see how it's not that scary. It might be scary
Yeah.
in the moment, but their stuffed animal can do it, so they can do it. They've got
Yeah.
it. um, yeah. So okay, I want to talk about just like how this experience of creating the toys has led to you understanding like the power of play. And I just want to talk about the power of play with you. We
Yeah.
work at a pediatric therapy clinic, and Pam's a pediatric OT, and she's built Marshall Pediatric Therapy, and we do play-based therapy for OT, PT, speech, mental health. So we know the power of play, which is amazing. But you've like taken it to a whole new level. um, so just tell me about like what you've learned from that, maybe some experiences that you've had of kids.
Yeah.
Yeah.
Yeah. So play, of course, as you know it is the way a child interacts with the world around them, and it is how they learn best. And I the one experience that I have that really clicked for me was when I was working in pediatric oncology. We had this, she was 3 or 4 years old, long-term patient, and she actually had a pick line. And I remember specifically when I finally got to take care of her, 'cause that's where I started my nursing career. So I had been there for about 6 months, and she had so many complex needs that I didn't get her until this one day. And I remember the nurse telling me she is so afraid of her blood draws to get labs in the morning. Try to do them while she's still asleep. And I went in there, and of course she's awake, and I'm thinking, ah, shoot, like what am I gonna do? And with the pick line, there's no poke, and it's a central line. You just draw labs from it, so she shouldn't really feel anything. Maybe the coolness of the flush, but there really shouldn't be much fear around it. So I was trying to think of a way to really build trust with her, because it was my first experience with her, and also show her exactly what's going to happen. So I took an IV and I taped it onto her teddy bear, and I started showing her what I was going to do, and it just completely flipped the script. So she was scared at first, and that simple moment of preparation with her, she ended up sitting through the blood draw totally fine on her own accord. And I thought, this was so easy. Like,
Yeah.
why is this given in report? Like, what? So that moment is what made me realize that like something as simple as play is huge for connecting with a kid and teaching them. But
Mhm.
then I left the room and I had to take the syringe with me because I didn't want her like injecting air into her own line. And she was so upset because she wanted to keep playing with her teddy bear and the IV. And that really was when I realized we need more medical toys. We need more realistic medical toys where these kids can play out their care that they're receiving with their own dolls and stuffed animals.
Yeah. Yeah, that's awesome. And I know like there are some medical toys or like doctor toys that you can buy at Walmart. But I love how yours are so realistic for the
Yeah.
kid. They're not like pink and glittery or
Mm-hmm.
they're they're realistic. And I've even seen on some of yours they have the logo, which is really cool
Yeah.
because it's not like, it's not like a feeding bag with, purple glittery pink with stars coming in it, it's
Yeah,
realistic.
we
So,
we got
yeah,
the licensing from Infinity to put the real Infinity logo on the feeding pump. So
I
a
love
lot
that.
of kids love seeing that, and there's a lot of kids too that just they really want stuff to match and look exactly like it. So that has been a huge hit for those kids where it matches exactly. They love that.
Yeah, I mean it makes sense. Like if you see yours and it's cute and pink and then you go to the hospital and it's that like bright orange with a logo on it, you're like, I that's not what I've been playing with, it's not
Right.
cool and it's not fun. But if you put that with their stuffed animal, then that's really sweet. So
Yeah,
that's
and
awesome.
I've had parents say there was a kid that was having trouble sitting still through his feeds, and she said all it took was the toy version where he sat completely still through his feed because he was playing with his own stuffy getting a feed as well. So it's things that like that, stories that even now, knowing the power of play, every time I hear a story like that, it's just so shocking that something that simple can have such a profound effect. And there was
Yeah.
another story actually from a speech language pathologist, and she had a kid who they were trying to get to use an AAC device, and he never touched it. He was not interested. And the day that she had our toy version, I made the logos big enough that we have multiple screen options, but I made them big enough where you can actually say, I want more drink food or bubbles, or like there's a couple different versions. And she said he grabbed it, the toy version, and used it to communicate. And then immediately after went over to his talker and used it. So like even something like that, it's just the fact it's a toy makes it just so much easier for a child to like grasp the concept and reduce their defenses. And instead of these adults saying, use this, do this to talk, they're just like, oh, I'm just playing. And like, it just makes it a totally different, it's a game changer for kids.
Yeah, definitely. What, like, from the neuroscience standpoint, like, what's happening to a child's brain whenever they're playing with these toys?
Man, so much. I the thing that I love to talk about and think about with it is play has access to the subconscious and like our implicit memories or the memories that where we don't have like visual episodic memories, but it's the memories that like live in our body, like the smell of something, the sound of something, or just the look of something and what that triggers in us. And if a child has a scary experience in a CT scan and afterwards they're allowed to play with that CT scanner machine and be the one in control, it literally rewires those experiences so that visual or the even the sound of the MRI, if you're playing that while they're playing now and they initially associated that sound with fear, by playing it while they're playing with the toy MRI, it is now rewiring their brain to have more a sense of empowerment or playfulness. So it has so much power, the neuroscience behind it. It's crazy.
That is crazy. That's awesome. Um, that's crazy. So, for parents listening, how would with them, like, once they buy a toy like this, um, how would they play with it at home? You've kind of given some experiences like with the feeding tube and doing it while they're being fed, or I mean, even with kids that don't have special needs or need these toys, how are ways that they could play with these toys to help them understand like maybe what their friend is going through or a sibling?
Yeah. You know, I think the most important thing is to stress that like you don't have to have medical knowledge and know how all these things work. And the child doesn't either. You just give it to them and they observe them. Honestly,
Mm-hmm.
that is the most powerful thing is just letting them free play and seeing what they think about it. And a lot of our toys do come with guides created by a child life specialist of like what you can say and different phrasing around it. And if you want to educate them on what it is, then it you can look it up and just try to explain things in simple terms. We're releasing a dialysis machine tomorrow, and I was teaching my daughter yesterday about it, and I have a cute little video, and it's really, you ask them what they think it is, and then you try to explain it in simple terms. And as you are explaining it, they'll come up with questions. So I was like, it's for if your kidneys don't work very well. What's a kidney? Oh, well, that's what makes your pee. So it's a lot of just like learning together. And sometimes she asks questions that I don't know the answer to, and we look it up together. So it's really, you don't have to have the medical knowledge. They can just play with it. But if you want to get deeper into it, then it's fun for all of us to educate ourselves and figure out what different medical needs are out there. So, yeah, that's it.
Yeah, I think that is awesome because, like, yeah, it's helping you and it's also helping them become curious about instead of I feel like in society there's like don't ask about it. But I'm sure like kids that have these medical needs or these devices on them, they don't mind talking about it. I mean, maybe they
Yeah.
do,
Have
but it
you,
helps with them.
yeah, and have
What was it?
you read the children's book Just Ask by Sonia Sotomayor?
I have not.
Oh, it's
No.
wonderful. So it's called Just Ask, and it walks through different disabilities or medical needs. And she herself had diabetes and was saying that she doesn't mind being asked about it. And growing up, like she liked it when people would just ask. But of course, if somebody's not comfortable with answering, if they don't want to be asked, they'll say that. But it is like you most of the time when kids are out in public, you don't want when your kid is staring to, oh, don't look at them, no, like that's if somebody has like a visual difference, like you want your kid to recognize it as normal. Like it's just we all have differences, so that's something that we practice in our house too, is that if somebody has like a visible difference and my daughter's curious, like we can look it up or we can ask, because that is what normalizes it, is exposure.
Yeah. Yeah, definitely. That that's cool. I'm gonna have to. I feel like that's a good resource for, especially a lot of the families that are listening, but also the therapists that are here. I'm sure they've heard of it, but just the therapists, because whenever we have our, in our clinic, everybody treats in the same area. So there may be a kid with CP also in the same room as a kid that maybe doesn't have any medical needs, or like is working on like speech therapy. So they could be like, oh, you know, just ask us, have that conversation. And that's why we treat in the same area, is there's like that socialization. Obviously there's other treatment rooms for private sessions, but you treat in the same room. Like there's the socialization aspect of it. So that's really cool. To expose them to those medical, those special needs and medical devices. So
Yeah.
awesome. Okay, another thing I would love to talk about is medically induced trauma. So what is it? How do you prevent it? What is it in like its simplest forms for moms who maybe have kids in a hospital or have medical experiences?
Yeah, it that is something that we are increasing awareness of. There's this other business that we're starting, and it is helping hospitals provide trauma-free care, because medically induced trauma is largely due to the way we provide care, not the illness itself. And for parents that where their kids are in the hospital, or nurses that may be listening, everyone knows that pediatric care is traumatic for really everybody involved, because no one goes into pediatrics to hold kids down, but often that's what we end up doing. And even I've been the parent with both of my kids having to hold them down for procedures, and it's terrible. And what we need to look at, there are resources out there, like child life specialists are really the champions of how to provide trauma-free care, but it's not integrated fully into the healthcare systems, and nurses aren't being trained on this type of care. So that's something that we need to fill the gap in, and what we're working to do is showing nurses that there is another way, because I've done some posts talking about medical trauma and memories I have having to hold kids down and how terrible it was, and there's so many nurses commenting, but what are we supposed to do instead, and it's for their safety. But it doesn't have to be physical safety or emotional safety. There are
Mm-hmm.
comfort holds. There's for vaccines, and where kids, or most children from the start, their first interaction with healthcare is getting vaccines. But why aren't we using lidocaine or cold numbing spray? Or there are things we can do for pain management so they don't feel the poke, and we're not utilizing that, because
Mm.
it for healthcare industry, it takes decades for research to be integrated into the standard of care. And there's research showing us that you can, like the buzzy bee, it's like a vibrating that releases neurotransmitters to block pain signals, that's supposed to help with the vaccination or IV start blood draw pain. And we're not utilizing this stuff. And so it is really just getting hospitals on board with the new research behind it, and trying to make this new way of care easy. So that's where we're coming in and helping hospitals with different frameworks to make it easy for nurses to provide trauma-free care.
That's awesome. And so for a mom, like, could they advocate for using these types of safety? How
Yes.
would they do that?
So, if you want to DIY it, you can buy the lidocaine creams and the Buzzy Bee and stuff on Amazon and just do it yourself. Like if you know your kid's going to get vaccines, you can, of course, clear it with your doctor because in case there's any allergies or anything. But um, most doctor's offices, I don't think would mind if you say, I want to put some lidocaine cream on 30 minutes before the appointment.
Mhm.
Where do you plan on giving the shots? And it might be in both legs or, so they can do it themselves or you ask. So when I took my daughter in a few months ago for her vaccines, I asked if they had the Buzzy Bee, and they said it was a little late. So they'd come in with all the vaccines ready to go, and I said, "Do you have the Buzzy Bee?" And she said, "Oh yeah, we just got it." So I said, "Oh, can you go get that, please?" So then they left the room, and then they got the Buzzy and came back, and we utilized it. So sometimes that's where when nurses or whoever's giving the shot is going through their day to day, we're stuck in this system one thinking is like what psychologists call it. And we're doing things by out of habit and automatically that if we have a new resource like this, it's not natural for us to think of including it. And so that's where we often these hospitals have these things available. They just aren't thinking of utilizing it in this scenario because they haven't been before. So that really is on us as parents to start asking, do you have the Buzzy Bee? Do you have the cold numbing spray? And eventually this will be as we with our other business start helping hospitals adopt these practices more standardly. It is going to be up to parents for now, but hopefully that will be changing.
That's awesome. Well, it does start with the parent too. A lot of the time, a lot of what our podcast is advocate or helping moms advocate for their kids, and knowing that like the mom really is the head of their child's medical team, and we just need to equip them with what are the resources that they can use, to what are the resources that they can use to advocate for better care for their child, which we know like hospitals have the best interest for their kids, but just like you said, like they're in that one track mind, or it may not be standard procedure. So it's nice to be able to equip our parents with this new this new technology that they can use to help maybe the medical safety. I mean, I remember as a kid running away from the doctor because I needed to get a shot, and that's probably not
Yeah.
safe either. So, that yeah, I love that, and I hope that we can have our moms advocate so much for the kids that it does become standard procedure to yeah, start integrating some safer ways of doing these procedures.
Yeah, and even asking if is there a child life specialist available, or
Mhm.
if your kid is experiencing resistance and you're having to hold them down, feeling empowered enough to say, "Hey, can we just take 5 minutes?" And
Mhm.
asking if there are comfort positions that we could try instead or something. Like sometimes it is just recognizing, like, can we just have 5 minutes to consider, like, is there a better way to do this?
Yeah.
And that it can be enough to change the whole thing.
Yeah. Yeah. That that's awesome. What are some ways, I mean, we're talking a little bit more about some safety, medical safety. Could you just expand a little bit more on medical safety, how these toys, how they feel emotionally safe with these toys, with these in healthcare?
Yeah, so I know emotional safety is kind of like a buzzword where if you're not really in the space, you don't know what it means. Like it doesn't it like
Mm-hmm.
a parent hearing emotional safety is probably like, well, that sounds kind of fluffy. Like what what is that? But it's really like looking at mental health and trying to prioritize that as much as we're prioritizing physical safety. And so emotional safety would be thinking of how it is affecting that child's emotions and mental health and this whole experience. So when a child goes into the hospital right now, we're so focused on their physical safety and health that we think,
Mm-hmm.
okay, we need to get this IV in because we need to get them fluid. So we're holding them down and they're having all this trauma from it. But then we get the IV and we're like, see, it's all good. You're fine. But they that lives in their body, that experience, and it ends up that trauma from that, it compounds. So now the next time they need any type of medical care, they're going to be more resistant. And it is going to be more likely to have failed IV insertions. And we have so many adults now that are delaying or avoiding getting medical care entirely because of their traumatic experiences as kids. So we really need to be looking at their emotional safety at the time and thinking what we're doing right now is sacrificing emotional safety really worth it in the long run at this
Mm-hmm.
moment? And most of the time it's not. And there are urgent scenarios where, of course, like we're going to have to think of their physical safety first, but most of the time we can figure out a way to help them emotionally, whether it's more preparation in educating them what's going to happen or providing them distraction or doing lidocaine. Like there's so many things we can think of to make the experience less traumatic for them.
Yeah. Yeah. I think of some friends who have had medical experiences since they've been in birth, and they're seeing things that are triggering to them. Ambulances, or, seeing an IV, like, is just, it's all triggering to them. And so I love that we're starting from a childhood and preventing those traumatic experiences, so that whenever they get to adulthood and maybe they still have medical needs, those kids who have medical needs from birth to whenever, they get older, we want to savor that, which that's awesome. I love that mission. So what is so think of a situation where a parent, like you were saying, they have to go through this traumatic experience for their physical safety. Are there ways to protect them after the situation, protect
Yes.
their emotional
Yeah. So
safety?
that's a huge part of it is with these experiences that are unfortunately probably going to happen to everybody sometime in their life. There is a way to help mitigate the trauma that you take away from it. And for kids, that is play. It's that the rewiring and the feeling empowered in being able to act out that experience with their toys, it naturally is going to help them reprogram and limit the trauma. And of course, there are some kids that have really significant phobias and traumas. And
Mm-hmm.
at that point, I would recommend a play therapist and a child life specialist, like we have these resources out there and getting them on board. And even if you don't have the privilege of having child life at your hospital, there are virtual child life specialists, like through the company Hearts Connected, where you can actually still meet with a child life specialist and get their expertise in figuring out a plan to help with that trauma that they may have.
Wow. That's really cool. I like that resource that you can get an online uh, child life specialist. So you talked a little bit about like getting the whole care team in this like play mindset. What does that look like? And again, like how do you advocate for that in your child's situation?
Yeah, I believe it's there's surprisingly some controversy around this because a lot of nurses think that play is left for the child life specialists, and there's some child life specialists that say nurses shouldn't be playing, that's our job. But the best teams are the ones that recognize play as a child's right in a way of communicating and teaching them. So when you think of it in that way, every single person that interacts with a child should be play minded. And it's because play is the way of connecting with kids. It's our way of building rapport and trust and lowering defenses and teaching them. And every team member can have their own way of utilizing play. So doctors and nurses can use it for patient education and showing what they're about to do, or simply just building trust with their patients. And child life specialists can take it deeper and really utilize it, which they do, but utilize it to help with their emotional safety. And play therapists can utilize it for helping manage those deeper emotions around their medical experiences. There's so many different ways that we can use play. And in order to encourage hospitals to adopt that, I think it really would be having play tools bedside. So
Mm.
if every hospital, a child's room, they had their teddy bear had a pick line, or whatever matching central line or IV, how easy it would be then for a nurse to be able to just show them a blood draw before doing it on the child, or or an echo tech if they had a toy echo and say, hey, you want to give your teddy an echo while I give you one, like. So there's different ways we can integrate it, and I think it really is having these tools available, because it's that visual cue, that gentle nudge of maybe you should pause and play first.
Yeah. Wow, I could talk to you about this all day. I feel like
Yeah,
this is
I know.
amazing. Everything that you're saying is amazing. Um, and I love. I really want to. I want our parents to take away how to equip and how to use this in in their own setting because
Uh,
yeah,
yeah, on that note, I do want to share
yeah.
for the parents listening, on the Apple App Store, we do have a free app called Playful Prescriptions. So that way you can do medical play without needing our toys even. It's
Wow.
of course you'll get different types of benefits from it, but if you type in there, I have a 5-year-old with asthma, it'll pop out three different, we call them play prescriptions, and it tells you a play idea and then the science behind it. And you can even say, I need to be able to do this from a hospital bed, or using supplies that I have at home. Like you can prompt it to do more specific play ideas. But that way they can start partaking in medical play without needing to buy our toys too.
Wow. You've like blown my mind with how in depth you've gone with providing and equipping parents with these toys and these tools so that because I mean, it goes even further. Like, I don't know, I'm sure you have something about just taking a simple pill. Like, the kids just
Oh,
take your
yeah.
medicine. Like, it's so traumatic for them for some reason, or just like drinking, just drink the medicine you need. Like it just
I know.
it's so hard. It doesn't taste great, but it's just so hard. So I
I
mean,
actually, we do. So we're clearly, this is like all I do this my entire life. We have
I love it.
something called Care Cloud, which is digital resources too. And so every month we're uploading a new digital resource to the Care Cloud. And one of them the other month was, it is all about taking oral medications. And I had to use that with my daughter because we needed her to take an allergy pill, and she's 6 now. So it was her first time having to swallow a pill. And of course she's like, no, I can't do it. And she was freaking out. So I sat with her, and one of the guys is, you might have used it before, but it's like a ladder. So you have them start by swallowing something small, like a little piece of chocolate or something. And then you gradually get bigger and having them practice until they swallow something the same size as the pill. And you're like, look, you did it. Now it's the pill time. And she did it. And so there are a lot of little tips and tricks like that. And a lot of it is like, yeah, it's being able to incorporate play into it.
Wow. I mean, it's like it really is a something parents just need to know about. Like it's just the knowledge cuz I mean as a kid it's just like you have to take this pill. Like, just get it over
Hmm.
with. Get the orange juice, get the apple juice, like find something you really like and then just take it and it'll all be
Hmm.
done. So, wow, that's awesome that there's just like different resources and different ways of helping kids. I mean, sometimes we
Hmm.
laugh in the clinics because a lot of what therapists do is tricking their kids into doing therapy. And so it's
Oh
kind
yeah.
of like let's kind of, we're not tricking, but we're like easing the anxiety of getting the progress done, and
Yeah.
with play, like it happens so much quicker, because it's just an
Yeah.
experience. So and I'm sure with, you were talking about your daughter, with the pill and everything, and I'm sure as a mom, as you're having these experiences with your kids, you're like creating new ideas. And I think
Oh yeah.
that's awesome. I love that you're a mom. You're a mom also in the situation, in the experiences that a lot of our moms are in. So that is just amazing. I
Yeah.
think
And
you're
my
doing
second
great.
daughter was in the NICU too for she was there for a couple weeks, and she had a CPAP and EEG and all these things on, and so it that was just last year. Wait, yeah, 2024.
Wow,
Still a pregnancy, post-pregnancy
I
brain.
get it.
So she was in the NICU for a couple weeks, and it was an interesting full circle moment, like being able to use the toys to prepare my older daughter to see her and visit her. And
Hmm.
so it's been, I feel like I've now experienced it from like every single angle possible. And it was really cool to see how, like, her recognizing the toys on her baby sister was something that she was excited about instead of like fearful of what is she going through? Why is all this happening to her?
Yeah. I was at Cincinnati Children's, which is like one of the top children's hospitals in the nation. And their child life specialists were amazing. They like came in and um they were talking to us as parents, and I don't have any other kids, but I saw other families who had like six kids with them, and I couldn't imagine explaining what's happening to their sibling, because it really is like daunting. Like my husband, even in the beginning, was like, I don't want to touch my daughter because she has so many things connected to her, and they're talking about the PIC line and how it's like really close to their heart, so you want to be careful. And my husband was like, I don't even want to touch her right now because that is so scary. So I
Yeah.
love that you're connecting with the child life specialists to communicate that with families, and not even, I mean, I would even see this as helpful for myself, as a mom,
Yeah.
and not even having other kids. So this just something to explain. I remember, yeah, I also remember like being in the hospital freshly postpartum and her explaining the PIC line and all of the dangers and, the whole spiel that they have to go through before they do this to your child. And I was like, this is terrifying. That it's like so
Yeah.
close to their heart, but the family life or child life specialist was like, a lot of babies do this, and the the nurses that do this are PIC line trained. Like they do this is the only thing they do. They go all around the hospital and they place PIC lines, and that's the only job that they have. So they're very specialized, and they're experts at this. So that really eased my worries and eased my anxiety about that. Okay.
Yeah.
We are coming up on the end of the episode, and I've loved having you on here. I wish I could just talk to you for days about this.
I
I know
know.
a lot of our therapists and our moms, I'm sure you just think about your company all the time, so you probably could talk about it for days. Um,
Yes. Weeks.
Oh, I bet. I bet. Okay, well, is there anything else that you want to touch on, for like equipping our moms to advocate for their child's and like be the head of their child's medical team? How would you encourage them, and what are some things that you could leave with them?
I would say just a reminder, even as a nurse, like I appreciated when the parents would stick up and ask for things for
Hmm.
their kids, and I find myself being bedside. It it is hard to feel that empowerment when you're actually in the medical like situation, and I've ended up like feeling really helpless in with my children's medical care and like not feeling comfortable speaking up. And so I know it's easier said than done, but it don't worry about like what they might think, like be the squeaky wheel and like ask for things, and more often than not, like it's they have resources to help with whatever it is that you need,
Hmm.
and they just need those cues and reminders to use them.
Yeah. Yeah, it really is. I think a lot of parents don't see it as a partnership between the healthcare provider
Yeah.
and the parent. And obviously, the healthcare provider is the expert in what's happening, but you're the expert in your child. So you really have to
Yeah.
partner with the healthcare provider to make sure that your child is getting the best care that they can. And you can provide that by knowing your child. Like, be the squeaky wheel, be the advocate for your child in that situation so that they don't have that medical trauma like you were talking about, and that they are
Yeah.
medically safe. You know how they're going to react to those procedures, or even just the prep for the procedure. So I love
Yeah.
that you're creating these toys for parents to explain this to their child, also for medical professionals to explain what's going on to their patients and families. I really think this is awesome. Could you give me just a rundown of all the resources? I'm sure you have a million,
Yeah.
but just like the top resources that our families can use, and then how they can find you.
Yeah.
That'd be great.
So I would say go to thebutterflypig.com. And that will you there is a resources menu on there, and you'll see, of course, our toys are you can purchase on that website. But also we have a link to the virtual child life specialists. Heart Connected is on there. Um, but we also have that free app in the Apple App Store called Playful Prescriptions. And on that resources page, there's our Care Cloud, and that is where all the digital resources are uploaded. So there's like coloring books, there's a Choose Your Own Adventure MRI coloring book, and printables for the oral medication tips and things to do, and different play ideas. So that's probably the most of the resources I can think of right now, but there's on that page will be the where we list everything.
Okay, awesome. We'll add it into the show notes as well and
Okay,
share it on our
perfect.
social media so everybody can know all the resources, amazing resources that you provide. I appreciate you so much for joining us. I was really excited about this episode.
Yeah.
Just it's amazing things that you're doing. Not even just for the family and the household, but nationwide and hopefully worldwide. You can change some procedures, change the way we do
Yeah.
things, and I love it. You're awesome, and you're leading a whole new generation of how we do healthcare. So I appreciate you, and I know a lot of the moms appreciate you.
Yeah, thank you.
Of course, of course. All right. Well, thank you so much for joining us.
Yeah, thank you for having me on.
All right.
Thanks so much for listening to Help, I Have Kids. If you're tuning into this podcast, that means you're a mom who's curious, committed, and ready to learn. And we see you. We'd love for you to join our Help, I Have Kids Facebook community, where moms just like you are connecting, asking questions, and encouraging each other every day. It's a space for real conversations, expert insight, and support from moms who get it, because we're all in this together. And if you know a mom who's feeling unsure or maybe overwhelmed, or just needs to be reminded that she can do it, she can advocate for her child with confidence, share this episode with her. We're building a village here, and we're glad you're a part of it.